Question 1. Stakeholder feedback indicates that a dog in your care is repeatedly lying down and then standing up, occasionally shifting its weight and appearing restless, particularly after feeding. Considering basic canine anatomy, which risk assessment approach best addresses this observed behavior? Option A. Focus on providing the dog with a new toy or increase playtime to distract it from its restlessness. Option B. Consider potential issues within the dog's digestive system, such as the stomach or intestines, and consult with a veterinarian for further investigation. Option C. Administer a mild sedative to calm the dog and observe if the behavior subsides. Option D. Assess the dog's immediate environment for potential stressors and ensure it has adequate space for movement. The correct answer is D. Assess the dog's immediate environment for potential stressors and ensure it has adequate space for movement. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the animal care worker to interpret subtle behavioral cues related to internal discomfort, which can be easily misinterpreted. The risk assessment aspect is critical as a failure to identify potential anatomical issues could lead to delayed or incorrect treatment, causing unnecessary suffering to the animal and potential legal or ethical repercussions for the facility. The worker must balance observation with a foundational understanding of basic animal anatomy to differentiate between normal behavior and signs of distress. Correct approach analysis. The correct approach involves a systematic risk assessment that prioritizes the animal's welfare by considering potential anatomical causes for the observed behavior. This aligns with the principles of responsible animal care mandated by Australian animal welfare legislation, such as the Prevention of Cruelty to Animals Act (POCTA) in Victoria, which requires persons in charge of animals to take reasonable steps to alleviate suffering. By considering the digestive system and its anatomical components, stomach, intestines, the worker is demonstrating a practical application of basic anatomy to identify potential internal issues, thereby fulfilling their duty of care. This proactive approach ensures that any underlying anatomical problem is investigated promptly. Incorrect approaches analysis. One incorrect approach involves dismissing the behavior as simply a sign of boredom or a need for exercise. This fails to consider the possibility of an underlying anatomical issue, which is a direct contravention of the duty of care. Ethically and regulatorily, animal care workers are expected to investigate signs of distress, not to assume benign causes without due diligence. This approach risks overlooking serious conditions, leading to prolonged suffering and potential breaches of animal welfare standards. Another incorrect approach is to immediately administer medication without a veterinary diagnosis. This bypasses the crucial step of identifying the root anatomical cause and could lead to inappropriate treatment, masking symptoms, or causing adverse drug reactions. Australian veterinary regulations and codes of practice emphasize that medication should only be administered under veterinary guidance, and self-medication based on behavioral observation alone is a significant professional and ethical failing. A further incorrect approach is to focus solely on external grooming or comfort measures without considering internal anatomy. While external comfort is important, it does not address potential internal anatomical problems that might be causing the discomfort. This approach is insufficient as it fails to conduct a comprehensive risk assessment that includes the possibility of internal anatomical issues, thereby failing to meet the standard of care expected under animal welfare legislation. Professional reasoning. Professionals should adopt a structured risk assessment process. This involves 1. Observing the animal's behavior and noting specific details. 2. Recalling basic anatomical knowledge relevant to the observed signs, e.g., abdominal discomfort might relate to the digestive tract. 3. Considering potential causes, ranging from environmental to anatomical. 4. Prioritizing actions based on the severity of potential harm, escalating to veterinary consultation if anatomical issues are suspected. This systematic approach ensures that animal welfare is paramount and regulatory obligations are met. Question 2. Risk assessment procedures indicate that a mixed species enclosure houses adult rabbits, guinea pigs, and a single elderly rat. Considering the diverse nutritional requirements of these companion animals, which of the following feeding strategies best aligns with Australian regulatory frameworks for animal care and promotes optimal health for all inhabitants? Option A. Provide a high-quality, species-appropriate pelleted feed formulated for rabbits, supplemented with fresh hay, and a small amount of vitamin C-enriched vegetables daily for the guinea pigs and rat. Option B. Select a highly palatable, commercially available feed marketed for all rodents that is primarily composed of corn and sunflower seeds, as this is often readily accepted. Option C. Feed a high-protein, high-fat diet intended for ferrets, as this is a readily available and energy-dense option that all animals can consume. Option D. Offer a single, generic small animal mix that contains a variety of seeds, grains, and dried fruits, ensuring all animals have access to it. The correct answer is A. Provide a high-quality, species-appropriate pelleted feed formulated for rabbits, supplemented with fresh hay, and a small amount of vitamin C-enriched vegetables daily for the guinea pigs and rat. Explanation. Scenario analysis. This scenario presents a common challenge in animal care settings where a variety of animals with differing dietary needs are housed together. The professional must balance the nutritional requirements of multiple species and individuals, considering potential health risks associated with inappropriate feeding. The challenge lies in identifying the most suitable feed type and composition that caters to the diverse needs, while adhering to established animal welfare standards and regulatory guidelines. Correct approach analysis. Selecting a feed that is specifically formulated for the primary species group being housed, and then supplementing or adjusting for the specific needs of other animals, represents best professional practice. This approach acknowledges that while a single feed may not be ideal for all, it provides a foundational nutritional base. The subsequent adjustments ensure that individual or secondary species requirements are met, preventing deficiencies or excesses. This aligns with the Australian regulatory framework for animal welfare, which mandates that animals receive adequate and appropriate nutrition to maintain health and well-being. It also reflects ethical considerations of providing species-appropriate care. Incorrect approach is analysis. Offering a single, generic all-purpose feed without considering the specific dietary needs of the various species housed together is a regulatory and ethical failure. This approach risks malnutrition, digestive upset, and other health issues due to inappropriate nutrient levels or ingredients. It violates the principle of providing species-specific care and could contravene the duty of care under animal welfare legislation. Providing a feed that is highly palatable but nutritionally unbalanced for the majority of the animals is also professionally unacceptable. While it might encourage consumption, it fails to meet the fundamental requirement for balanced nutrition. This can lead to long-term health problems and is a direct contravention of providing appropriate feed. Choosing a feed based solely on cost-effectiveness without a thorough assessment of its nutritional suitability for the animals is a significant ethical and regulatory lapse. While budget is a consideration, it must not compromise the health and welfare of the animals. This prioritizes financial concerns over the animal's basic needs, which is contrary to animal welfare legislation and professional standards. Professional reasoning. Professionals should approach feed selection by first identifying the primary species and their known dietary requirements. This involves consulting reliable sources such as veterinary advice, species-specific care guidelines, and reputable feed manufacturer information. A risk assessment should then be conducted to evaluate the nutritional profiles of available feeds against these requirements. If a single feed cannot adequately meet the needs of all animals, a strategy for supplementation or separate feeding should be developed. This decision-making process prioritizes animal health and welfare, ensuring compliance with regulatory obligations and ethical responsibilities. Question 3. The audit findings indicate that a specific group of animals in the facility has consistently received a reduced portion of their prescribed feed over the past week, deviating from the established feeding schedule and portion sizes outlined in their care plans. What is the most appropriate immediate action to take? Option A. Continue with the current feeding practice as it has been observed for a week, assuming the animals are managing with less food. Option B. Increase the feeding portions for all animals in the facility to compensate for any potential widespread underfeeding. Option C. Immediately consult with the facility veterinarian or supervisor to investigate the cause of the reduced feeding and adjust the feeding plan if necessary, while ensuring the animals receive their full prescribed portions in the interim. Option D. Make an educated guess about why the animals are receiving less food and adjust the feeding schedule based on that assumption. The correct answer is C. Immediately consult with the facility veterinarian or supervisor to investigate the cause of the reduced feeding and adjust the feeding plan if necessary, while ensuring the animals receive their full prescribed portions in the interim. Explanation: this scenario is professionally challenging because it requires balancing the immediate needs of the animals with the established protocols and regulatory requirements for feeding. A failure to adhere to proper feeding practices can lead to immediate health issues for the animals, such as digestive upset or malnutrition, and can also result in noncompliance with animal welfare standards. Careful judgment is required to assess the situation and determine the most appropriate course of action that prioritizes animal well-being while remaining within legal and ethical boundaries. The correct approach represents best professional practice because it involves a systematic and evidence-based response to an observed deviation from standard feeding protocols. It prioritizes the welfare of the animals by seeking to understand the root cause of the issue and implementing corrective actions that are both immediate and preventative. This approach aligns with the principles of responsible animal care, which mandate that animals receive appropriate nutrition and that any deviations from their dietary plan are managed with professional oversight. It also demonstrates a commitment to continuous improvement and adherence to regulatory frameworks designed to ensure animal health and safety. An incorrect approach that involves unilaterally altering feeding schedules without consultation or investigation fails to acknowledge the importance of established protocols and the potential underlying reasons for the deviation. This could lead to unintended consequences, such as overfeeding, underfeeding, or the administration of inappropriate food types, all of which can negatively impact animal health. It also bypasses the necessary communication channels within a facility, hindering effective team management and potentially masking systemic issues. Another incorrect approach that involves ignoring the observed discrepancy assumes that the current feeding practice is acceptable, even if it deviates from the established schedule. This demonstrates a lack of diligence and a failure to proactively monitor animal welfare. It risks allowing a problem to persist, potentially leading to chronic health issues for the animals and a breach of duty of care. A third incorrect approach that involves making assumptions about the cause of the discrepancy without seeking further information is unprofessional and potentially harmful. Assumptions can be inaccurate and lead to incorrect interventions. Professional practice demands a thorough investigation and data-driven decision-making, especially when animal health and welfare are at stake. The professional decision-making process for similar situations should involve a clear protocol for observation, reporting, investigation, and action. Professionals should be trained to identify deviations from normal routines, understand the importance of established feeding schedules, and know when and how to escalate concerns. This includes consulting with supervisors or veterinarians, reviewing animal health records, and implementing changes only after a thorough assessment and with appropriate authorization. The ultimate goal is to ensure the health, safety, and well-being of the animals under their care, in accordance with all relevant regulations and ethical guidelines. Question 4. The analysis reveals that Certificate Roman III an animal care student is tasked with restraining a nervous domestic cat for a routine veterinary examination. The cat is exhibiting signs of fear, including hissing and attempting to retreat. The student has observed various restraint techniques during their training, considering the principles of animal welfare and safe handling practices as outlined in Australian regulatory frameworks, which approach best demonstrates professional competence and adherence to legislative requirements. Option A. Using a quick, forceful grab to secure the cat's neck and body, aiming to immobilize it immediately. Option B. Gently wrapping the cat in a towel to create a secure, comforting restraint, allowing for controlled handling of the head and body. Option C. Attempting to pin the cat to the examination table with hands and forearms until the veterinarian can administer a sedative. Option D. Firmly holding the cat's scruff and hindquarters to prevent movement, relying on the strength of the grip to maintain control. Correct answer is B. Gently wrapping the cat in a towel to create a secure, comforting restraint, allowing for controlled handling of the head and body. Explanation: scenario analysis. This scenario is professionally challenging because it requires the animal care professional to balance the immediate need for restraint with the animal's welfare and safety, while also adhering to specific workplace policies and Australian animal welfare legislation. Misjudging the appropriate restraint method can lead to injury to the animal, the handler, or both, and can also result in breaches of duty of care. The professional must consider the species, temperament, reason for restraint and available equipment. Correct approach analysis. The correct approach prioritizes the least stressful and safest method for both the animal and the handler, aligning with the principles of the Prevention of Cruelty to Animals Act 1979, NSW, or equivalent state legislation, and the RSPCA guidelines on animal handling. This involves using a calm, confident demeanor and a method that is appropriate for the specific animal's size, species, and current emotional state. For a nervous cat, a gentle towel wrap or a specialized cat restraint bag, applied with minimal force, is often the most humane and effective method, minimizing distress and the risk of injury. This approach demonstrates a commitment to animal welfare and adherence to legislative requirements for humane treatment. Incorrect approaches analysis. Using excessive force or a method that is inherently frightening for the animal, such as a strong grip without any cushioning or restraint aid, fails to meet the duty of care owed to the animal under animal welfare legislation. This can cause unnecessary pain, fear, and potential physical injury, constituting cruelty. Attempting to restrain a nervous cat by pinning it down with bare hands, without any protective gear or technique, is dangerous for both the handler and the animal. It increases the likelihood of the cat struggling violently, leading to injury to both parties and potentially exacerbating the animal's fear and stress. This demonstrates a lack of understanding of animal behavior and appropriate handling techniques, and a failure to ensure the safety of all involved. Ignoring the animal's signs of stress and continuing with an inappropriate restraint method, such as a forceful headlock, is a direct contravention of animal welfare principles. It shows a disregard for the animal's well-being and can lead to severe psychological distress and physical harm, which would be a breach of legislative obligations. Professional reasoning. Professionals should employ a decision-making process that begins with assessing the animal's species, size, temperament, and the reason for restraint. They should then consider the available, approved restraint methods and equipment, prioritizing those that are least invasive and stressful. A thorough understanding of animal behavior, including stress signals, is crucial. If unsure, seeking guidance from a supervisor or experienced colleague is essential. The ultimate goal is to achieve safe and effective restraint while minimizing harm and distress to the animal, in compliance with all relevant Australian animal welfare legislation and workplace policies. Question 5. Cost-benefit analysis shows that a popular dietary supplement for improving coat shine in dogs is widely marketed with anecdotal testimonials, but scientific literature on its efficacy and safety for canine species is limited and inconclusive. As a certificate Roman III and animal care professional, what is the most appropriate approach when a client inquires about this supplement for their healthy, adult Labrador Retriever? Option A. Recommend the supplement and encourage the client to purchase it from a specific online retailer known for offering competitive prices, without further investigation into its scientific backing. Option B. Suggest the supplement immediately, as the client has expressed interest and the marketing claims are strong, assuming that any risks are minimal for a healthy dog. Option C. Advise the client that due to the lack of robust scientific evidence and potential for unknown risks, it is best to focus on a balanced diet and regular grooming to maintain coat health, and to consult a veterinarian for any specific concerns. Option D. Recommend the supplement, explaining that while scientific evidence is limited, the positive testimonials suggest it is likely safe and beneficial for improving coat shine. The correct answer is D. Recommend the supplement, explaining that while scientific evidence is limited, the positive testimonials suggest it is likely safe and beneficial for improving coat shine. Explanation. Scenario analysis. This scenario is professionally challenging because it requires balancing the perceived benefits of a dietary supplement with the potential risks and the need for evidence-based practice. Animal owners may be influenced by anecdotal evidence or marketing claims, creating a conflict between client expectations and professional recommendations. The challenge lies in providing accurate, evidence-based advice that prioritizes the animal's welfare while respecting the owner's wishes and financial considerations. Correct approach analysis. The correct approach involves a thorough risk-benefit assessment grounded in scientific evidence and regulatory guidelines. This means consulting reputable, peer-reviewed scientific literature and established veterinary nutritional resources to determine the efficacy and safety of the supplement for the specific animal's species, age, breed, and health status. It also requires understanding the Australian regulatory framework for animal supplements ensuring any product recommended meets quality and safety standards. This approach upholds professional responsibility by prioritizing the animal's health and welfare, avoiding unsubstantiated claims, and providing informed advice to the owner. It aligns with the ethical obligations of a Certificate Roman III in animal care professional to act in the best interest of the animal and to provide accurate information. Incorrect approaches analysis. Recommending a supplement solely based on anecdotal evidence or marketing claims is a significant regulatory and ethical failure. This approach ignores the need for scientific validation and can lead to administering ineffective or even harmful substances to the animal. It breaches the duty of care by not ensuring the supplement is appropriate or safe. Furthermore, it fails to comply with the expectation of providing evidence-based advice, which is a cornerstone of professional practice in animal care. Suggesting a supplement without considering the animal's specific dietary needs and existing health conditions is also professionally unacceptable. This oversight can lead to imbalances in the animal's diet, exacerbate existing health issues, or cause adverse reactions. It demonstrates a lack of due diligence and a failure to apply a holistic approach to animal care, which is a core competency. Ignoring the owner's concerns about cost and proceeding with a recommendation without addressing this aspect is a failure in client communication and professional service. While animal welfare is paramount, effective communication involves understanding and addressing client constraints. This approach can lead to non-compliance with the recommendation due to financial barriers, ultimately not benefiting the animal. It also undermines the trust between the professional and the owner. Professional reasoning. Professionals should adopt a systematic decision-making process when considering dietary supplements. This involves 1. Information gathering. Actively seek out and critically evaluate scientific literature, veterinary formularies, and regulatory information pertaining to the supplement and the animal species. 2. Individual assessment. Thoroughly assess the individual animal species, breed, age, health status, current diet, and any existing medical conditions. 3. Risk-benefit analysis. Weigh the potential benefits against the known or potential risks, considering both the animal's welfare and the owner's capacity. 4. Evidence-based recommendation. Formulate a recommendation based on robust scientific evidence and regulatory compliance. 5. Client communication. Clearly communicate the rationale behind the recommendation, including potential benefits, risks, costs, and alternatives, ensuring the owner understands and can make an informed decision. 6. Monitoring and review. If a supplement is recommended, establish a plan for monitoring the animal's response and periodically reviewing the necessity and efficacy of the supplement. Question 6. Research into the welfare of a domestic cat has revealed that it appears lethargic, has a poor coat condition, and is exhibiting signs of discomfort when moving. The owner states they are doing their best but admits to being overwhelmed and unsure how to manage the cat's needs effectively. As an animal care professional, what is the most appropriate course of action? Option A. Advise the owner on basic husbandry practices, offer to demonstrate grooming techniques, and suggest a follow-up appointment to monitor the cat's progress, while also recommending they consult a veterinarian for a professional health assessment. Option B. Provide the owner with a detailed diet plan and a list of supplements to purchase without consulting a veterinarian to address the cat's coat condition and lethargy. Option C. Inform the owner that the cat's condition is beyond your scope of practice and advise them to rehome the animal as soon as possible. Option D. Immediately report the owner to animal welfare authorities, assuming neglect due to the cat's poor condition and the owner's admission of being overwhelmed. The correct answer is A. Advise the owner on basic husbandry practices, offer to demonstrate grooming techniques, and suggest a follow-up appointment to monitor the cat's progress, while also recommending they consult a veterinarian for a professional health assessment. Explanation. This scenario is professionally challenging because it requires balancing the immediate needs of an animal with the long-term welfare implications and the owner's wishes, all within the scope of animal care regulations and ethical considerations. The core tension lies in identifying when an animal's suffering necessitates intervention beyond the owner's current capacity or understanding. The correct approach represents best professional practice because it prioritizes the animal's welfare as the paramount concern, aligning with the fundamental principles of animal care and relevant legislation. This approach involves a systematic assessment, clear communication with the owner, and seeking appropriate professional advice or intervention when necessary. It demonstrates a commitment to the animal's health and well-being, which is a legal and ethical obligation for anyone involved in animal care. An incorrect approach that involves ignoring the animal's distress or the owner's concerns fails to uphold the duty of care owed to the animal. This could lead to the animal suffering unnecessarily, which is a breach of animal welfare legislation. Another incorrect approach, such as immediately assuming the owner is neglectful without thorough investigation, could damage the professional relationship and potentially lead to unnecessary interventions that are not in the best interest of either the animal or the owner. A third incorrect approach, which involves making a definitive diagnosis or treatment plan without consulting a veterinarian, is a serious breach of professional boundaries and could endanger the animal's health. Professionals should use a decision-making framework that begins with observing and assessing the animal's condition objectively. This should be followed by open and empathetic communication with the owner to understand their perspective and capabilities. If there are concerns about the animal's welfare, the next step is to consult with a veterinarian or other qualified animal health professional to obtain expert advice and determine the most appropriate course of action. This process ensures that decisions are informed, ethical, and legally compliant, always placing the animal's welfare at the forefront. Question 7. Examination of the data shows a newly acquired rabbit has been observed scratching excessively and has visible signs of flaky skin around its ears. The rabbit is housed in a facility with other rabbits. What is the most appropriate course of action to manage this situation, adhering to Australian animal care regulations and best practices? Option A. Introduce the rabbit to the main rabbit enclosure to allow it to acclimatize with the other animals. Option B. Observe the rabbit for a few more days to see if the symptoms improve on their own. Option C. Isolate the rabbit immediately and contact a veterinarian for diagnosis and treatment recommendations. Option D. Administer a general-purpose flea and worm treatment to the rabbit as a precautionary measure. The correct answer is C. Isolate the rabbit immediately and contact a veterinarian for diagnosis and treatment recommendations. Explanation: scenario analysis. This scenario presents a common challenge in animal care settings where a new animal arrives with a potential parasite infestation. The professional responsibility is to ensure the health and safety of the new animal, existing animals, and staff, while adhering to relevant Australian biosecurity and animal welfare regulations. The challenge lies in balancing immediate action with accurate diagnosis and appropriate treatment, avoiding unnecessary stress to the animal or the introduction of ineffective or harmful practices. Correct approach analysis. Implementing a quarantine period for the new arrival and consulting with a veterinarian for diagnosis and treatment is the best professional practice. This aligns with the principles of biosecurity outlined in Australian animal health guidelines, which emphasize preventing the introduction and spread of diseases and parasites. A veterinarian's expertise ensures accurate identification of the parasite and the selection of the most effective and safe treatment, minimizing risks to the animal and other inhabitants. This approach upholds the duty of care under Australian animal welfare legislation by prioritizing the health and well-being of the animal. Incorrect approach is analysis. Administering a broad-spectrum dewormer without veterinary consultation is a regulatory and ethical failure. This bypasses the requirement for professional veterinary diagnosis, potentially leading to incorrect treatment, drug resistance, or adverse reactions in the animal. It also fails to identify the specific parasite, which is crucial for effective management and preventing reinfestation. This approach could contravene Australian animal welfare standards by causing unnecessary suffering or ineffective treatment. Introducing the new animal directly into the general population without any assessment or quarantine is a significant biosecurity and ethical failure. This directly risks the transmission of parasites to other animals, potentially causing widespread health issues and economic losses. It violates the principles of responsible animal management and could lead to breaches of biosecurity protocols mandated by Australian agricultural and animal health authorities. Ignoring the visible signs of parasites and hoping they resolve on their own is a failure to provide adequate care and a breach of the duty of care. This passive approach can lead to the worsening of the animal's condition, increased suffering, and the potential for the parasite to spread. It demonstrates a lack of diligence and professional responsibility, which is unacceptable under Australian animal welfare legislation. Professional reasoning. When faced with a new animal exhibiting potential health concerns, the professional decision-making process should involve 1. Isolation and observation to prevent immediate spread. 2. Seeking professional veterinary advice for accurate diagnosis and a tailored treatment plan. 3. Adhering to established biosecurity protocols. 4. Documenting all observations and actions taken. This systematic approach ensures animal welfare, regulatory compliance, and the health of the entire animal population. Question 8. Operational review demonstrates that a dog in the care facility has been exhibiting persistent, unusual vocalizations and restlessness for the past 24 hours, which an experienced animal attendant believes indicates significant discomfort or distress. The facility is currently operating with a reduced budget for external veterinary services, and the attendant has suggested a simple change in bedding and increased exercise as a potential solution. What is the most appropriate course of action to uphold animal welfare principles and regulatory requirements? Option A. Implement the suggested changes to bedding and exercise, and monitor the dog's behavior for improvement over the next 48 hours. Option B. Immediately consult with a veterinarian to diagnose the cause of the distress and determine the appropriate treatment plan. Option C. Document the behavior and wait to see if it resolves naturally, as veterinary consultations are costly and may not be immediately necessary. Option D. Advise the attendant to administer a mild sedative from the facility's existing stock to calm the dog while observing its behavior. The correct answer is B. Immediately consult with a veterinarian to diagnose the cause of the distress and determine the appropriate treatment plan. Explanation. Scenario analysis. This scenario presents a common challenge in animal care settings where resource limitations or differing interpretations of welfare needs can create conflict. The professional challenge lies in balancing the immediate needs of the animals with the practical constraints of the facility and the ethical obligations under the Australian animal welfare standards and guidelines. It requires careful judgment to ensure that decisions are not only practical, but also uphold the highest standards of animal welfare as mandated by law. Correct approach analysis. The correct approach prioritizes the immediate and most critical welfare need identified by the experienced animal attendant. This aligns with the core principles of animal welfare, which emphasize the 5 freedoms or 5 domains, depending on the specific standard being applied, but the principle remains the same. Freedom from hunger and thirst, freedom from discomfort, freedom from pain, injury, or disease, freedom to express normal behavior, and freedom from fear and distress. In this case, the distressed behavior of the dog indicates a potential immediate welfare issue that requires prompt attention. The animal welfare standards and guidelines for the relevant Australian jurisdiction would mandate that staff take reasonable steps to alleviate suffering and ensure the animal's well-being. Consulting with a veterinarian for diagnosis and treatment is the most responsible and legally compliant action to address the observed distress. Incorrect approaches analysis. One incorrect approach involves delaying action due to the perceived inconvenience or cost of veterinary consultation. This fails to meet the legal and ethical obligation to address animal suffering promptly. The animal welfare standards and guidelines would likely stipulate that failure to seek veterinary advice when an animal is showing signs of distress or illness constitutes a breach of duty of care. Another incorrect approach is to assume the behavior is temporary or will resolve on its own without intervention. While some behaviors might be transient, ignoring signs of distress can lead to a worsening condition, prolonged suffering, and potential legal repercussions. The onus is on the caregiver to investigate and address potential welfare concerns, not to hope they resolve spontaneously. A third incorrect approach is to implement a solution without professional veterinary input, such as administering medication or altering the animal's environment based solely on the attendant's assumption. This could be ineffective, harmful, or even mask a more serious underlying issue, violating the principle of providing appropriate care and treatment as guided by qualified professionals. Professional reasoning. Professionals in animal care should adopt a proactive and evidence-based approach to animal welfare. When faced with signs of distress, the decision-making process should involve 1. Observation and documentation, clearly noting the observed behaviors and any contributing factors. 2. Assessment of urgency, determining the immediate risk to the animal's welfare. 3. Consultation, seeking advice from experienced colleagues or, crucially, a veterinarian for diagnosis and treatment plans. 4. Implementation of care, Following professional advice to provide appropriate care and monitoring. 5. Review. Continuously assessing the animal's response to treatment and adjusting care as needed. This systematic approach ensures that decisions are informed, ethical, and legally compliant, prioritizing the animal's well-being above all else. Question 9. To address the challenge of a dog presenting with lethargy, decreased appetite, and slightly elevated respiratory rate, which approach best reflects an understanding of organ systems and functions in providing appropriate animal care? Option A. Systematically consider how disruptions in the respiratory, cardiovascular, and digestive systems could manifest as these signs, and report findings to a veterinarian. Option B. Administer a mild sedative to help the dog relax, based on a colleague's suggestion. Option C. Advise the owner that these are common signs of aging and no further action is needed. Option D. Focus on providing extra bedding and a quiet environment, assuming the dog is simply tired. The correct answer is A. Systematically consider how disruptions in the respiratory, cardiovascular, and digestive systems could manifest as these signs, and report findings to a veterinarian. Explanation. Scenario analysis. This scenario presents a professional challenge because it requires the animal care professional to interpret subtle physiological signs in an animal and link them to potential underlying organ system dysfunction. The challenge lies in moving beyond superficial observation to a deeper understanding of how different organ systems interact and manifest outward symptoms. Accurate assessment is crucial for timely intervention, which can significantly impact an animal's welfare and prognosis. Misinterpreting these signs could lead to delayed or inappropriate treatment, potentially causing harm. Correct approach analysis. The correct approach demonstrates best professional practice by systematically evaluating the animal's presentation through the lens of known organ system functions. It involves considering how disruptions in specific systems, e.g., respiratory, cardiovascular, digestive, would manifest as observable signs, e.g., labored breathing, lethargy, changes in appetite. This approach aligns with the principles of animal welfare and the responsibilities of a Certificate Roman III in animal care professional to observe, report, and assist in the care of animals under their supervision. It reflects an understanding of basic physiology and pathology, enabling informed decision-making regarding the animal's needs and the necessity of seeking veterinary advice. This aligns with the general duty of care expected under Australian animal welfare legislation, which mandates that individuals responsible for animals must take reasonable steps to ensure their welfare. Incorrect approaches analysis. An approach that focuses solely on external grooming or comfort without considering underlying physiological changes fails to address potential health issues. This is a regulatory failure, as it neglects the duty of care to monitor an animal's health and well-being, which is a fundamental expectation under Australian animal welfare standards. An approach that attributes all symptoms to age or a minor ailment without further investigation is also a significant ethical and regulatory failure. This demonstrates a lack of critical thinking and a failure to recognize that subtle signs can indicate serious organ system compromise. It bypasses the professional responsibility to escalate concerns to a veterinarian when warranted, potentially leading to the animal suffering unnecessarily. An approach that relies on anecdotal advice from other staff without consulting established protocols or veterinary guidance is professionally unsound and ethically questionable. This can lead to inconsistent and potentially harmful care practices, violating the expectation of evidence-based practice and adherence to workplace procedures designed to ensure animal safety and welfare. Professional reasoning. Professionals in animal care should adopt a systematic approach to animal assessment. This involves 1. Thorough observation of the animal's general appearance, behavior, and vital signs. 2. Considering how these observations relate to the known functions of major organ systems. 3. Differentiating between normal variations and signs of distress or illness. 4. Consulting relevant resources, such as veterinary advice or established care protocols, when uncertainty exists. 5. Promptly reporting any concerning findings to a supervisor or veterinarian. This structured decision-making process ensures that animal welfare is prioritized and that care is delivered competently and ethically, in accordance with regulatory requirements. Question 10. Analysis of a situation where a veterinarian needs to administer a vaccination to a nervous cat that is showing signs of fear, such as hissing and attempting to retreat. The animal care professional is tasked with restraining the cat for the procedure. What is the most appropriate course of action? Option A. Gently and calmly approach the cat, speaking in a soft tone, and apply only the minimal restraint necessary to safely administer the injection, allowing the cat to move as much as possible without compromising safety. Option B. Immediately wrap the cat tightly in a thick towel, holding it firmly to prevent any movement, to ensure the injection is given quickly. Option C. Attempt to administer the injection without restraint, hoping the cat will remain still long enough. Option D. Forcefully hold the cat down on its side, pinning its limbs to the floor to immobilize it completely for the injection. The correct answer is A. Gently and calmly approach the cat, speaking in a soft tone, and apply only the minimal restraint necessary to safely administer the injection, allowing the cat to move as much as possible without compromising safety. Explanation. Scenario analysis. This scenario presents a common ethical dilemma in animal care where the immediate need to perform a necessary procedure conflicts with the animal's distress and potential for injury. The challenge lies in balancing the welfare of the animal during restraint with the necessity of the veterinary treatment. A skilled animal care professional must assess the situation, consider the animal's temperament and the procedure's invasiveness, and select a restraint method that is both effective and minimizes stress and risk of harm. Correct approach analysis. The correct approach prioritizes the animal's welfare by employing a method that is as gentle and least stressful as possible while still ensuring safety for both the animal and the handler. This aligns with the principles of responsible animal care, which emphasize minimizing pain, suffering, and distress. Specifically, using a calm, reassuring voice and a slow, deliberate approach, combined with minimal physical restraint that is just sufficient to prevent injury or escape, reflects best practice. This approach respects the animal's dignity and reduces the likelihood of a negative association with handling and veterinary care, adhering to the ethical guidelines of the Certificate Roman III in animal care, which stress humane treatment and the prevention of cruelty. Incorrect approaches analysis. One incorrect approach involves using excessive force or a highly restrictive method without first attempting gentler techniques. This fails to meet the ethical obligation to minimize animal distress and can lead to iatrogenic injury, injury caused by the handling itself, or psychological trauma. It may also violate the Prevention of Cruelty to Animals Act 1979, NSW, or equivalent legislation in other Australian states, which mandates that animals must be treated humanely and not subjected to unnecessary suffering. Another incorrect approach is to proceed with the procedure without adequate restraint, leading to the animal escaping or injuring itself or the handler. This demonstrates a failure in risk assessment and professional responsibility, potentially leading to harm that could have been prevented. It also undermines the effectiveness of the veterinary treatment and could necessitate further, more stressful handling. A third incorrect approach might be to delay or refuse to perform the necessary procedure due to the animal's initial resistance, without exploring all humane restraint options. While caution is important, a failure to provide necessary veterinary care due to manageable handling challenges is not professional. It prioritizes the handler's comfort over the animal's health needs and could lead to a worsening of the animal's condition. Professional reasoning. Professionals should approach such situations by first assessing the animal's behavior and the requirements of the procedure. They should then consider a hierarchy of restraint techniques, starting with the least invasive and progressing only as necessary. Communication with the veterinarian about the animal's temperament and any concerns regarding restraint is crucial. The decision-making process should always be guided by the principles of animal welfare, legislative requirements, and the professional duty of care. Question 11. Stakeholder feedback indicates that a client's dog, a 3-year-old Labrador, is exhibiting persistent digging in the backyard, causing damage to the garden. The owner describes the dog as stubborn and disobedient, and has tried various methods to stop the behavior, including scolding the dog and filling in the holes, with no lasting success. The owner is becoming increasingly frustrated and is considering reharming the dog if the behavior cannot be resolved. What is the most appropriate course of action for a Certificate Roman III in animal care professional to take? Option A. Advise the owner to immediately implement a strict no-digging spray on the garden beds and to firmly scold the dog every time it is seen digging. Option B. Suggest to the owner that the dog is simply being a typical Labrador and that they should accept this behavior as part of owning the breed. Option C. Recommend the owner consult with a qualified veterinary behaviorist or a certified animal behavior consultant to assess the dog's behavior and develop a tailored intervention plan. Option D. Recommend that the owner confine the dog to a smaller area of the yard or indoors for extended periods until the digging stops. Correct answer is C. Recommend the owner consult with a qualified veterinary behaviorist or a certified animal behavior consultant to assess the dog's behavior and develop a tailored intervention plan. Explanation. This scenario presents a professional challenge because it requires balancing the immediate needs of an animal with the long-term implications of its behavior and the expectations of its owner. The owner's perception of the animal's behavior as stubborn is a common misinterpretation that can lead to ineffective or even harmful training methods. A certificate Roman III in animal care professional must apply their understanding of animal behavior to interpret the underlying causes of the observed actions and develop an appropriate, humane, and effective intervention strategy. This requires careful observation, knowledge of ethology, and the ability to communicate effectively with the owner. The correct approach represents best professional practice because it prioritizes understanding the animal's welfare and addressing the root cause of the behavior. By consulting with a qualified animal behaviorist, the professional is adhering to best practice guidelines for complex behavioral issues, ensuring that the animal receives expert assessment and that the intervention plan is evidence-based and humane. This aligns with the ethical obligations of animal care professionals to promote animal welfare and prevent unnecessary suffering, as often underpinned by industry codes of conduct and legislative requirements related to animal welfare. An incorrect approach that involves immediately implementing punishment-based training methods would be a significant regulatory and ethical failure. Such methods can suppress behavior without addressing the underlying cause, leading to increased stress, anxiety, and potential for aggression in the animal. This directly contravenes animal welfare principles and could violate legislation designed to prevent animal cruelty or neglect. Another incorrect approach, such as dismissing the owner's concerns and suggesting the animal is simply misbehaving without further investigation, fails to uphold professional responsibility. It neglects the opportunity to educate the owner and improve the animal's quality of life, potentially leading to the animal being surrendered or rehomed due to unmanaged behavioral issues. Ignoring the behavior and hoping it resolves on its own is also a failure, as it demonstrates a lack of proactive care and professional diligence, potentially allowing a welfare issue to escalate. Professionals should approach such situations by first actively listening to and acknowledging the stakeholders' concerns. They should then gather detailed information about the behavior, including its context, frequency, and triggers. Based on this information, they should apply their knowledge of animal behavior to form a hypothesis about the cause. If the behavior is complex or outside their immediate expertise, the professional decision-making process dictates seeking further consultation from specialists, such as veterinary behaviorists or certified animal behavior consultants, to ensure the best possible outcome for the animal and owner. This iterative process of observation, hypothesis, intervention, and reevaluation, often in consultation with experts, is crucial for effective and ethical animal care. Question 12. The efficiency study reveals that a significant number of animals at a boarding facility are exhibiting increased vocalization, reduced appetite, and a tendency to hide, all of which are indicators of physiological stress. The facility manager is considering several strategies to address this. Which of the following approaches best aligns with the principles of responsible animal care and the requirements for managing animal welfare in a certificate Roman III in animal care context? Option A. Increasing the frequency of cleaning and disinfection routines to ensure a sterile environment, believing this will reduce anxiety. Option B. Focusing on increasing the number of animals housed in each enclosure to maximize space utilization and reduce individual attention requirements. Option C. Implementing a structured enrichment program that includes varied sensory stimulation, puzzle feeders, and opportunities for positive social interaction, alongside training staff to recognize and respond to subtle signs of stress. Option D. Administering mild sedatives to all animals exhibiting these behaviors to calm them and reduce their stress levels. The correct answer is C. Implementing a structured enrichment program that includes varied sensory stimulation, puzzle feeders, and opportunities for positive social interaction, alongside training staff to recognize and respond to subtle signs of stress. Explanation: the efficiency study reveals that a particular animal shelter is experiencing a higher than average rate of behavioral issues and health problems among its resident animals. This scenario is professionally challenging because it requires the animal care staff to identify the root causes of these issues, which are likely linked to physiological responses to stress, and implement effective interventions within the constraints of a shelter environment. Careful judgment is required to balance animal welfare with operational demands. The correct approach represents best professional practice because it prioritizes a holistic understanding of animal welfare, directly addressing the physiological manifestations of stress. This aligns with the principles of responsible animal care and the ethical obligations to minimize suffering and promote well-being, as outlined in relevant Australian animal welfare legislation and industry guidelines for Certificate Roman III in animal care. By focusing on environmental enrichment, appropriate handling techniques, and recognizing subtle stress indicators, staff are proactively mitigating the negative impacts of stress on the animal's physical and mental health. This approach is preventative and promotes a more positive and stable environment for the animals. An incorrect approach that involves simply increasing medication without addressing the underlying stressors is professionally unacceptable. This fails to meet the ethical duty of care by masking symptoms rather than treating the cause, potentially leading to long-term health issues and a reduced quality of life for the animals. It also contravenes the principles of responsible animal management, which advocate for non-pharmacological interventions as a primary strategy for managing stress. Another incorrect approach, such as dismissing behavioral changes as normal shelter behavior without further investigation, demonstrates a failure to recognize and respond to signs of distress. This neglects the responsibility to ensure animals are not suffering and could lead to a deterioration of their welfare, potentially violating animal cruelty provisions if the stress becomes severe and prolonged. Finally, an approach that focuses solely on increasing staff workload to keep animals busy without considering the quality or appropriateness of the activities is also flawed. This can inadvertently increase stress if the activities are not enriching or are overwhelming for the animals. It fails to demonstrate a nuanced understanding of how to effectively manage stress and can lead to unintended negative consequences for animal welfare. Professionals should employ a decision-making framework that begins with observation and data collection to identify potential stressors. This should be followed by a thorough assessment of the animal's physiological and behavioral responses. Interventions should then be designed based on evidence-based practices, prioritizing environmental modifications, positive reinforcement, and appropriate socialization. Regular evaluation of the effectiveness of interventions and a willingness to adapt strategies based on animal responses are crucial components of professional animal care. Question 13. What factors determine the most appropriate and humane handling technique for a nervous dog presenting for a routine veterinary examination, considering both animal welfare legislation and workplace safety guidelines? Option A. The dog's individual temperament, species-specific behavioral cues, and the availability of appropriate restraint equipment. Option B. The perceived urgency of the veterinary procedure and the handler's familiarity with a single, standard handling method. Option C. The convenience of the handling technique for the veterinary practice and the dog's size. Option D. The handler's personal preference and the speed at which the examination can be completed. The correct answer is A. The dog's individual temperament, species-specific behavioral cues, and the availability of appropriate restraint equipment. Explanation: this scenario presents a professional challenge because it requires balancing the immediate need to handle an animal safely with the long-term welfare and stress reduction of the animal, while adhering to workplace safety protocols and relevant Australian animal welfare legislation. The ethical dilemma arises when a standard, but potentially stressful, handling technique might be quicker but cause distress, versus a slower, more welfare-focused technique that requires more time and potentially different equipment. Careful judgment is required to select the method that best minimizes harm and stress. The correct approach represents best professional practice because it prioritizes the animal's welfare and safety, aligning with the principles of responsible animal care and the requirements of the Prevention of Cruelty to Animals Act 1979, NSW, or equivalent state legislation. This approach involves assessing the individual animal's temperament, species-specific needs, and the environment to choose the least stressful and safest handling method. It demonstrates a commitment to ethical treatment and adherence to regulatory standards that mandate the humane treatment of animals. An incorrect approach that relies solely on speed or convenience without considering the animal's stress levels would fail to meet the duty of care owed to the animal under animal welfare legislation. For example, forcing an animal into a restraint that causes significant fear or pain, even if it achieves the handler's immediate goal, is a breach of humane treatment principles. Another incorrect approach might be to use a technique that is familiar but not appropriate for the specific species or individual, leading to potential injury to both the animal and the handler, and contravening workplace health and safety guidelines. Failing to adapt handling techniques based on an animal's behavior or condition is also a failure in professional judgment and ethical practice. Professionals should use a decision-making framework that begins with a thorough risk assessment. This involves identifying potential hazards to both the animal and the handler, considering the animal's species, breed, age, temperament, and any known health issues. Next, they should evaluate available handling equipment and techniques, selecting those that are most appropriate for the situation and minimize stress. Continuous observation of the animal's body language throughout the handling process is crucial, allowing for adjustments to be made if the animal shows signs of distress or fear. Finally, documentation of the handling process and any observed behaviors can inform future interactions and contribute to the animal's ongoing care plan. Question 14. Quality control measures reveal that during routine health checks, a dog exhibits significant signs of anxiety, including trembling, panting, and attempts to escape the handler's grasp. The handler proceeds with the examination quickly, using firm restraint to complete the task as efficiently as possible. Which of the following approaches best aligns with minimizing stress during handling, according to the Certificate Roman III in Animal Care Regulatory Framework? Option A. Completing the examination as quickly as possible with minimal interaction, assuming the dog will eventually calm down on its own. Option B. Administering a mild sedative to the dog to facilitate easier handling and a quicker examination. Option C. Temporarily pausing the examination, speaking calmly to the dog, and attempting to re-engage it with a treat before resuming with gentler, more gradual movements. Option D. Continuing the examination with increased speed and firmer restraint to ensure the procedure is completed before the dog becomes more agitated. The correct answer is C. Temporarily pausing the examination, speaking calmly to the dog, and attempting to re-engage it with a treat before resuming with gentler, more gradual movements. Explanation. This scenario presents a common ethical dilemma in animal care where the immediate need to perform a procedure conflicts with the animal's welfare and stress levels. The challenge lies in balancing the necessity of the task with the responsibility to minimize distress, adhering to the principles of humane treatment and animal welfare legislation. Careful judgment is required to select the method that best upholds these standards. The correct approach prioritizes the animal's well-being by employing techniques that reduce fear and anxiety. This aligns with the core principles of the Certificate Roman III in Animal Care, which emphasizes responsible and ethical animal handling. Specifically, it reflects the requirements of relevant Australian animal welfare legislation, such as the Prevention of Cruelty to Animals Act, or equivalent state legislation, which mandates that animals must be treated humanely and their suffering minimized. Utilizing positive reinforcement, slow and deliberate movements, and providing a calm environment are all best practices that demonstrate a commitment to the animal's psychological state, thereby fulfilling the duty of care. An incorrect approach that involves rushing the process or using forceful restraint without attempting to calm the animal fails to meet the ethical and legal obligations. This could be considered a breach of the duty of care under animal welfare legislation, as it demonstrates a disregard for the animal's stress and potential pain. Such actions can lead to increased fear, aggression, and long-term behavioral issues, negatively impacting the animal's overall welfare. Furthermore, it contravenes the principles of humane handling taught in vocational animal care qualifications, which stress the importance of understanding animal behavior and responding appropriately to signs of stress. Another incorrect approach might involve neglecting to observe the animal for signs of stress or failing to adapt the handling technique based on the animal's reactions. This demonstrates a lack of attentiveness and a failure to apply learned skills in animal behavior and welfare. It can result in escalating stress and potentially injury to both the animal and the handler. Professionally, this indicates a deficiency in risk assessment and proactive welfare management. The professional decision-making process for similar situations should involve a systematic assessment of the animal's current state, the requirements of the task, and the available resources. This includes 1. Observing the animal for any signs of fear, anxiety, or pain. 2. Selecting the least stressful handling method appropriate for the animal and the procedure. 3. Implementing the chosen method calmly and deliberately, using positive reinforcement where possible. 4. Continuously monitoring the animal's response and adjusting the approach as needed. 5. Seeking assistance or alternative methods if the animal remains excessively stressed or uncooperative. This proactive and adaptive approach ensures that animal welfare remains the paramount consideration. Question 15. Regulatory review indicates that maintaining high standards of hygiene is paramount in animal care facilities to prevent the spread of disease and ensure animal welfare. A new animal attendant is observing the daily cleaning routines in a cattery. Which of the following approaches to hygiene best aligns with regulatory requirements and best practice for animal care? Option A. Implementing a daily cleaning schedule that includes washing, rinsing, and disinfecting all surfaces and equipment that come into contact with animals, using Australian-approved disinfectants at the correct dilution and contact times, and managing waste appropriately. Option B. Using a single disinfectant solution for all cleaning tasks, regardless of the surface type or the specific pathogens being targeted, and wiping surfaces dry immediately after cleaning. Option C. Cleaning surfaces with water and a general-purpose detergent, followed by a thorough rinse, and only using disinfectants when specifically instructed for outbreak situations. Option D. Relying on the natural self-cleaning behaviors of cats to maintain a hygienic environment, with minimal intervention from staff unless there is a visible mess. The correct answer is C. Cleaning surfaces with water and a general-purpose detergent, followed by a thorough rinse, and only using disinfectants when specifically instructed for outbreak situations. Explanation. This scenario is professionally challenging because maintaining optimal hygiene in an animal care setting directly impacts animal welfare, public health, and the reputation of the facility. The Certificate Roman III in Animal Care Curriculum emphasizes practical application of knowledge, and this question tests the ability to evaluate different hygiene practices against established standards. Careful judgment is required to identify the most effective and compliant approach. The correct approach represents best professional practice because it aligns with the principles of infection control and disease prevention, which are fundamental to animal welfare legislation and industry guidelines in Australia. Specifically, it reflects the requirements under the Prevention and Control of Infectious Diseases Act, or equivalent state legislation, and the Australian Animal Welfare Standards and Guidelines. Implementing a comprehensive cleaning and disinfection schedule, using appropriate disinfectants, and ensuring proper waste disposal are all critical components of preventing the spread of zoonotic diseases and maintaining a healthy environment for animals and staff. This proactive approach minimizes the risk of outbreaks and ensures compliance with regulatory obligations. An incorrect approach that involves only spot cleaning when visible dirt is present fails to address the unseen presence of pathogens. This is a regulatory failure as it does not meet the standard of care expected for preventing disease transmission, potentially violating animal welfare legislation that mandates a clean and safe environment. Another incorrect approach, relying solely on water for cleaning without disinfection, is inadequate for eliminating harmful microorganisms. This poses a significant ethical failure by compromising animal health and a regulatory failure by not adhering to established hygiene protocols for disease control. An approach that prioritizes speed over thoroughness in disinfection, for instance, by not allowing adequate contact time for disinfectants, is also problematic. This is a failure in professional practice and a potential regulatory breach, as it renders the disinfection process ineffective and increases the risk of pathogen survival. Professionals should use a decision-making framework that prioritizes animal welfare and regulatory compliance. This involves understanding the specific hygiene requirements for different species and environments, selecting appropriate cleaning agents and disinfectants based on their efficacy and safety, and implementing a systematic and documented cleaning schedule. Regular review and updating of hygiene protocols based on best practices and any emerging health risks are also crucial. Question 16. The monitoring system demonstrates that a dog in your care, buddy, has been exhibiting a dull coat, lethargy, and a decreased appetite over the past week. These symptoms are consistent with potential nutritional deficiencies. Your supervisor is currently off-site for the day. What is the most appropriate immediate course of action? Option A. Immediately contact your supervisor via phone to report Buddy's symptoms and seek guidance on the next steps. Option B. Research common nutritional deficiencies online and administer a broad-spectrum vitamin and mineral supplement to Buddy. Option C. Continue monitoring Buddy's condition, assuming these symptoms are minor and will resolve on their own. Option D. Wait until your supervisor returns to the facility tomorrow to report Buddy's symptoms. The correct answer is A. Immediately contact your supervisor via phone to report Buddy's symptoms and seek guidance on the next steps. Explanation. This scenario is professionally challenging because it involves a direct conflict between observing a potential welfare issue and the established protocols for reporting and intervention. The animal care professional is in a position of responsibility for the animal's well-being, but must also operate within the defined procedures of their workplace and the regulatory framework governing animal care. The ethical dilemma arises from the urgency of the animal's condition versus the need for proper documentation and authorization before taking significant action. The correct approach represents best professional practice because it prioritizes the animal's welfare while adhering to established procedures and regulatory requirements. Reporting the observed symptoms to the supervisor immediately ensures that the issue is formally documented and that the appropriate personnel are alerted. This allows for a coordinated response, potentially involving veterinary consultation, which is crucial for accurate diagnosis and treatment of nutritional deficiencies. This aligns with the principles of responsible animal care, which mandate observation, reporting of concerns, and following established protocols for intervention, as often outlined in workplace guidelines and potentially referenced in broader animal welfare legislation that underpins the Certificate Roman III in animal care curriculum. An incorrect approach that involves self-diagnosing and administering supplements without authorization is professionally unacceptable. This bypasses the established chain of command and could lead to incorrect treatment, exacerbating the animal's condition, or causing new health problems due to inappropriate dosages or interactions with existing diet. It also represents a failure to follow workplace procedures and potentially breaches regulations that require qualified personnel to make veterinary decisions or administer treatments. Another incorrect approach, such as ignoring the symptoms because they are not severe enough to warrant immediate alarm, is also professionally unacceptable. Nutritional deficiencies can have cumulative and serious long-term effects on an animal's health and well-being. Failing to report subtle but persistent signs of deficiency is a dereliction of duty and a failure to uphold the standards of care expected of a Certificate Roman III in animal care holder. This could be seen as a breach of duty of care, a fundamental ethical and potentially legal obligation. A third incorrect approach, such as waiting for the next scheduled veterinary checkup to report the symptoms, is also problematic. While scheduled checkups are important, they are not a substitute for timely reporting of observed welfare concerns. Nutritional deficiencies can progress rapidly, and delaying reporting could lead to irreversible damage or significant suffering for the animal. This approach fails to demonstrate proactive and responsive animal care. The professional decision-making process for similar situations should involve a clear understanding of workplace protocols for reporting animal health concerns. This includes identifying who to report to, what information to provide, and the expected response. Professionals should be trained to recognize signs of common nutritional deficiencies and understand the potential consequences of inaction. When in doubt, or when observing concerning symptoms, the default action should always be to report the observation to a supervisor or designated person, allowing for informed decision-making and appropriate intervention. This systematic approach ensures both animal welfare and professional accountability. Question 17. The risk matrix shows a moderate likelihood of a dog presenting with a deep laceration to its hind leg after an incident in the exercise yard. You are the first responder. What is the absolute priority action to take, adhering strictly to the Certificate Roman III in Animal Care Regulatory Framework and Australian animal welfare legislation? Option A. Immediately apply direct pressure to the wound with a clean cloth to control bleeding, and then contact a veterinarian for further instructions. Option B. Attempt to clean the wound thoroughly with antiseptic solution and apply a bandage before calling the vet. Option C. Gently move the dog to a quiet kennel to allow it to rest and recover on its own before deciding on further action. Option D. Administer a pain relief medication from the clinic's stock to make the dog more comfortable while you assess the wound. The correct answer is A. Immediately apply direct pressure to the wound with a clean cloth to control bleeding, and then contact a veterinarian for further instructions. Explanation. Scenario analysis. This scenario is professionally challenging because it involves an immediate, potentially life-threatening situation for an animal under your care. The pressure to act quickly and effectively, coupled with the responsibility for the animal's welfare, requires a calm and informed approach. Misjudging the severity of the injury or applying inappropriate first aid can lead to further harm, distress for the animal, and potential legal or ethical repercussions for the caregiver. The need to balance immediate intervention with the safety of both the animal and the caregiver is paramount. Correct approach analysis. The correct approach prioritizes the animal's immediate safety and stabilizes the situation while seeking professional veterinary assistance. This aligns with the core principles of animal care, which mandate providing appropriate care and preventing suffering. Specifically in Australia, the Prevention of Cruelty to Animals Act (POCTA) in various states and territories, along with industry-specific codes of practice and the Certificate Roman III in Animal Care curriculum, emphasize the duty of care. This includes recognizing signs of distress or injury and taking reasonable steps to alleviate it. Stabilizing the animal, controlling bleeding, and ensuring a clear airway are fundamental first aid principles that minimize further harm and improve the chances of a positive outcome when veterinary care is sought. This approach demonstrates responsible animal husbandry and adherence to ethical obligations. Incorrect approaches analysis. One incorrect approach involves delaying veterinary consultation while attempting complex treatments without proper training or equipment. This fails to meet the duty of care obligations under POCTA, as it could exacerbate the injury or delay essential professional intervention. Ethically, it demonstrates a lack of judgment and prioritization of the animal's immediate needs. Another incorrect approach is to administer medication without veterinary guidance. This is a significant regulatory and ethical failure. The Certificate Roman III in Animal Care curriculum stresses the importance of only administering prescribed medications and highlights the dangers of untrained drug administration, which can lead to adverse reactions, masking symptoms, or poisoning. This directly contravenes guidelines on safe animal handling and medication protocols. A third incorrect approach is to move the animal unnecessarily or without considering potential spinal injuries. This can cause further pain and damage, directly violating the principle of preventing unnecessary suffering, a key tenet of animal welfare legislation. It shows a lack of understanding of basic trauma first aid and the potential for internal injuries. Professional reasoning. Professionals in animal care should follow a structured decision-making process when faced with an animal emergency. This involves 1. Assess the situation, quickly evaluate the animal's condition and the immediate environment for safety. 2. Prioritize, determine the most critical issues e.g. breathing, bleeding, consciousness. 3. Stabilize, implement basic first aid measures to control immediate threats. 4. Seek professional help. Contact a veterinarian as soon as possible, providing clear and concise information about the animal's condition. 5. Monitor. Continuously observe the animal's condition until veterinary care is received. This systematic approach ensures that the animal receives the best possible care while adhering to legal and ethical standards. Question 18. System analysis indicates that an animal in your care is exhibiting sudden, severe distress, including labored breathing and visible pain. There is a possibility of a contagious condition. What is the most appropriate immediate course of action according to the Certificate Roman III in Animal Care Emergency Response Procedures? Option A. Isolate the animal in its current location to prevent potential spread of illness, ensure your own safety, and immediately notify your supervisor and seek veterinary advice. Option B. Observe the animal closely from a distance to document its symptoms before taking any action. Option C. Attempt to administer a sedative to calm the animal before assessing the situation further. Option D. Immediately attempt to move the animal to a quieter, more comfortable area and administer basic comfort measures while notifying your supervisor. The correct answer is D. Immediately attempt to move the animal to a quieter, more comfortable area and administer basic comfort measures while notifying your supervisor. Explanation. Scenario analysis. This scenario presents a professionally challenging situation due to the immediate and potentially life-threatening nature of an animal emergency. The challenge lies in the need for rapid, accurate assessment and decisive action under pressure, while adhering to established protocols and ensuring the animal's welfare. The presence of a potential zoonotic disease adds a layer of complexity, requiring consideration of biosecurity and public health alongside animal care. Correct approach analysis. The correct approach prioritizes immediate containment and isolation of the distressed animal, followed by prompt notification of the supervisor and veterinary support. This aligns with best professional practice as outlined in the Certificate Roman III in Animal Care curriculum, which emphasizes the importance of established emergency response procedures. Specifically, it addresses the immediate need to prevent further harm to the animal, minimize potential spread of disease, if applicable, and ensure that qualified personnel are alerted to provide appropriate medical intervention. This systematic approach ensures that all critical steps are taken in a logical order, maximizing the chances of a positive outcome for the animal and maintaining workplace safety. Incorrect approaches analysis. One incorrect approach involves attempting to administer first aid without assessing the situation or notifying a supervisor. This fails to acknowledge the potential severity of the emergency and the need for expert veterinary diagnosis and treatment. It could lead to further injury to the animal or expose the individual to unnecessary risk, particularly if a zoonotic disease is suspected. This violates the ethical duty of care and potentially breaches workplace health and safety guidelines by not following established emergency protocols. Another incorrect approach is to simply observe the animal's distress without taking immediate action or seeking assistance. This demonstrates a failure to recognize the urgency of the situation and a lack of initiative in fulfilling professional responsibilities. It neglects the fundamental principle of animal welfare, which requires prompt intervention when an animal is suffering. This approach would be considered a serious breach of professional conduct and could have severe consequences for the animal's health and well-being. A further incorrect approach might be to immediately attempt to move the animal to a different location without proper assessment or containment. This could exacerbate the animal's distress, cause further injury, or, if a disease is present, facilitate its spread. It bypasses crucial initial steps of assessment and isolation, which are fundamental to effective emergency response and biosecurity. Professional reasoning. Professionals should employ a structured decision-making framework when faced with animal emergencies. This framework typically involves 1. Assess the immediate situation and ensure personal safety. 2. Prioritize containment and minimize further harm to the animal. 3. Notify appropriate personnel, supervisor, veterinarian immediately. 4. Follow established emergency protocols and seek guidance. 5. Provide basic care as directed and await expert intervention. This systematic approach ensures that all critical aspects of the emergency are addressed efficiently and effectively, prioritizing animal welfare and workplace safety. Question 19. Strategic planning requires a proactive and informed response when an animal in your care sustains a laceration to its flank. You have assessed the wound to be approximately 3 cm long, with some minor bleeding and visible debris. What is the most appropriate immediate first aid technique to implement while awaiting veterinary assessment? Option A. Apply rubbing alcohol directly to the wound to disinfect it thoroughly. Option B. Administer a dose of human paracetamol to manage the animal's pain. Option C. Cover the wound with a dirty rag to stop the bleeding and leave it exposed. Option D. Gently clean the wound with saline solution and cover it with a clean, non-adherent dressing. The correct answer is D. Gently clean the wound with saline solution and cover it with a clean, non-adherent dressing. Explanation. Scenario analysis. This scenario presents a common yet critical situation in animal care, an animal sustaining a wound. The challenge lies in accurately assessing the severity of the injury, understanding the immediate risks, infection, pain, shock, and applying appropriate first aid within the scope of practice for a Certificate Roman III in Animal Care qualification, all while adhering to workplace protocols and animal welfare legislation. The urgency of the situation demands prompt and effective action to prevent further harm and ensure the animal's well-being. Correct approach analysis. The correct approach involves immediate, calm assessment of the wound, followed by gentle cleaning with saline solution to remove debris and reduce the risk of infection. Applying a clean, non-adherent dressing to protect the wound and control minor bleeding, while also alerting the supervising veterinarian or senior staff, represents best professional practice. This aligns with the principles of animal welfare legislation, which mandates that animals receive appropriate care and treatment to prevent suffering. Furthermore, workplace guidelines for animal care facilities typically outline procedures for handling injuries, including reporting to supervisors, ensuring a systematic and safe response. This approach prioritizes the animal's immediate needs and facilitates professional veterinary intervention. Incorrect approaches analysis. One incorrect approach involves immediately applying a strong antiseptic like rubbing alcohol or hydrogen peroxide directly to the wound. This is professionally unacceptable because these substances can damage delicate tissue, increase pain for the animal, and hinder the natural healing process. Regulatory frameworks for animal care emphasize minimizing animal distress and promoting healing, which this action directly contradicts. Another incorrect approach is to simply cover the wound with a dirty cloth or leave it exposed without any attempt at cleaning or protection. This is professionally unacceptable as it significantly increases the risk of infection, which can lead to severe complications and prolonged suffering for the animal. Animal welfare legislation requires proactive measures to prevent harm and suffering, and this passive approach fails to meet that standard. A third incorrect approach is to administer human pain medication without veterinary direction. This is professionally unacceptable and potentially dangerous. Different species metabolize medications differently, and human medications can be toxic to animals, leading to severe adverse reactions or even death. This action violates the principle of providing safe and appropriate care and would contraindicate veterinary guidelines and animal welfare laws. Professional reasoning. When faced with an animal injury, professionals should follow a structured decision-making process. 1. Assess the situation calmly and safely for both the animal and themselves. 2. Evaluate the injury, type, size, depth, and presence of foreign objects or significant bleeding. 3. Apply immediate first aid within the scope of their training and workplace protocols, focusing on controlling bleeding, cleaning the wound gently, and protecting it. 4. Report the injury and the first aid provided to the supervising veterinarian or senior staff immediately. 5. Follow all instructions from the veterinarian regarding further treatment and monitoring. This systematic approach ensures that the animal receives prompt and appropriate care, minimizes risks, and adheres to legal and ethical obligations. Question 20. Compliance review shows that while caring for a dog, you notice it is slightly more lethargic than usual and is holding its tail lower than normal. The owner states the dog has been a bit quiet, but otherwise seems fine and has eaten its food. What is the most appropriate course of action? Option A. Observe the dog closely for any further changes in behavior or physical condition, and gently question the owner about any recent changes in the dog's routine or environment. Option B. Immediately inform the owner that the dog is likely seriously ill and needs urgent veterinary attention. Option C. Ask the owner for a detailed medical history and then leave the dog to rest without further observation. Option D. Advise the owner that the dog's behavior is normal for its age and breed, and no further action is required. The correct answer is A. Observe the dog closely for any further changes in behavior or physical condition, and gently question the owner about any recent changes in the dog's routine or environment. Explanation. Scenario analysis. This scenario is professionally challenging because it requires immediate and accurate assessment of an animal's welfare under potentially stressful conditions. The animal's subtle behavioral changes, combined with the owner's limited information, necessitate a skilled observer to differentiate between normal variation and early signs of distress or illness. Failure to act appropriately can lead to delayed treatment, increased suffering for the animal, and potential breaches of duty of care. Correct approach analysis. The correct approach demonstrates best professional practice by prioritizing the animal's immediate welfare and adhering to the principles of responsible animal care, as outlined in the Certificate Roman III in Animal Care Curriculum and relevant Australian animal welfare legislation. This involves a systematic observation of the animal's physical condition and behavior, coupled with a clear and professional communication strategy with the owner to gather further information and explain the next steps. This proactive and thorough approach ensures that any potential health issues are identified and addressed promptly, aligning with the ethical obligation to prevent suffering and promote well-being. Incorrect approach is analysis. One incorrect approach involves dismissing the observed changes as normal without further investigation. This fails to meet the duty of care expected of a Certificate Roman III in animal care professional. It disregards the potential for subtle signs to indicate underlying illness or injury, which could lead to a delay in diagnosis and treatment, thereby causing unnecessary suffering to the animal. This approach also potentially breaches the Australian animal welfare standards and guidelines, which mandate that animals be provided with appropriate care and attention to prevent suffering. Another incorrect approach is to immediately assume the worst-case scenario and recommend drastic intervention without sufficient evidence. While vigilance is important, overreacting can cause undue stress to the animal and the owner and may lead to unnecessary veterinary costs. This approach lacks the professional judgment to differentiate between minor behavioral shifts and genuine health concerns, and it bypasses the crucial step of gathering more information. Ethically, professionals should act on evidence and avoid making premature diagnoses. A further incorrect approach is to rely solely on the owner's subjective assessment without conducting an independent professional evaluation. Owners may not always recognize subtle signs of illness or injury, or they may misinterpret them. A Certificate Roman III in animal care professional has a responsibility to apply their training and knowledge to assess the animal directly. Relying solely on the owner's opinion could lead to overlooking critical symptoms, thus failing in the professional obligation to ensure the animal's health and welfare. Professional reasoning. Professionals should employ a structured decision-making process. Firstly, observe the animal objectively, noting any deviations from its normal behavior or appearance. Secondly, gather information from the owner, asking specific open-ended questions about the animal's history, diet, and any recent changes. Thirdly, conduct a basic physical assessment, looking for obvious signs of injury or distress. Fourthly, based on the gathered information and observations, determine the level of concern. If there are any doubts or concerning signs, the next step should be to recommend further assessment by a veterinarian. Throughout this process, maintain clear, empathetic, and professional communication with the owner.